My name is Jodi Dickson, and I'm an RN, and I'm the clinical coordinator of the Outpatient Behavioral Health Department. My responsibility at Genesis Outpatient Behavioral Health is that, first of all, I'm an RN, so I'm making sure that patients' needs are being met through medication management, through attending therapies, and then I also coordinate the program, so I make sure that our clinicians are getting what they need to provide patient care so that our patients get the highest quality of treatment there. The most rewarding part about working in the community that I live in, it's really amazing when you're out at the local store and you run into a patient that you had several years ago and they run up to you and they tell you, I'm doing really well and I'm doing good at my job, and they tell you their successes, and it makes me feel really good that I had a part in that success. Also, I really try hard within our community to try to fight the stigma of mental health and get the education out there that there is help in our community for whatever services that folks need. At Genesis Behavioral Health, we have a very comprehensive level of services. We start with inpatient behavioral health, and that level of care are for folks that really need to be monitored closely. They need a safe environment. They need very intensive treatment at that time. Our next level of care for outpatient behavioral health is that we have an intensive outpatient program. And what that program is a group therapy program that's sort of like still being in the hospital, but yet you can go home. So that makes it so unique, so you can still have that high level of treatment, but you're coming to our facility 3 times a week for 3 hours a day for group therapy with some very talented clinicians that we have working with us. And then the nice piece is that we work closely with our psychiatrists in town, and they do weekly med management visits. So if there's any need for medication adjustments, they can get that taken care of right in our program. Our next service that we offer is that we have an outpatient drug and alcohol recovery program. So we offer the same type of behavioral health groups, that intensive outpatient 3 hours a group 3 times a week program, to individual therapy, to driver intervention programs, to court diversion programs. So there's a lot of different things that are happening in that drug and alcohol program, all outpatient. To receive treatment in outpatient mental health is just the optimal choice of treatment, because our patients can continue living their normal lives, their normal addresses with their families, but yet they can come in for intensive treatment. I love this level of care because patients aren't in a bubble protected from all their stressors in their lives. They still have to go home and deal with whatever is going on, and they come back to us and figure out different ways to cope with those stressors and different ways to look at things in order to improve their mental health. The continuum of mental health care, we look at inpatient for the patients that maybe aren't safe, that patient that their mood is deteriorated so low that they're having suicidal thoughts. We want to keep them. Safety is our primary assessment factor. So those folks would be inpatient for a while until they're stable, and then we look at outpatient treatment so that we get them back to their homes, back to their environments, and then continue treatment there. So that's kind of how we decide who needs inpatient, who needs outpatient. We are very fortunate to have psychiatric nurses in our emergency department at Genesis. So if anyone has any concerns and are not sure what kind of level of care they need, go to ER, especially if they're having suicidal thoughts and the mood has deteriorated, and they can assess them, and also an emergency room physician will assess them and decide what level of care they need. Most insurances will cover the cost of treatment. We, of course, never want that to be an issue for anyone to look for treatment, because we can always try to find help for them. When folks do enter into our facility, we check benefits, we let them know what their responsibility might be. If there are concerns for any financial issues, we get them referred to our resource counseling department, because there's always ways that we can help them get treatment. So finances shouldn't be the main issue to seek treatment. Anyone can get more information about our services by calling our main number. Our staff would be happy to talk with you and see what's going on, offer suggestions of where you might receive the best treatment in our area. But I must really stress, if you are having any suicidal thoughts, don't hesitate, go to the emergency department and be screened there to see what you need.